So here's a couple of examples of health technology and using design thinking and design processes in this context. I'm going to talk about four key examples. Two apps. One is our care journal, co-design with carers. Another one is a recent AI app about grieving. Then a virtual reality chore robots and automated showering, all projects to do with aged care. And then virtual care pods, a healthcare setting project. And as I talk through these, I think you'll get a sense of, and you'll know this anyway from your own experience, but you'll get a sense of the challenges associated with technology deployment and then some of the strategies we can deploy to try and smooth those bumps out. So this is a few years ago now, and we tried to co-design an app to support Australia's informal carers. It's about 1 in 10 Australians, quite a lot, 2.65 million people who are informal carers for a loved one. That means that they're unpaid and they do some kind of caring activities. So they might be, it might be a wife caring for a husband with dementia. It might be a child caring for a mother who's had a stroke. It might be a mother caring for a child who's got an intellectual disability. Those are the kind of things we're talking about. And we wanted to see, could we put an app together that would assist them in doing that? And it's a way they could have one central place to record all the kind of information they've got to keep track of, from medications, doctor's appointments, to little things like pain and sleep. That's not a little thing, it's a big thing actually. But and blood pressure and even things like bowel movements, all kinds of information that instead of being written down on a piece of paper somewhere or emailed all over the place could be recorded in one place and it could be shared as appropriate, between the care team and to doctors and nurses. So what do we do? So we ran a number of design thinking sessions with a number of different activities where we asked carers to tell us a little bit about their life. So on the first activity on the left here, we asked them to map out with images what they did when using images. To sort of tell us a day in their life. And then to map out, stickers where there were times of the day that were most energy demanding, and then to talk about what sort of happened on a typical day and then a crisis day, and talk about how information technology, in particular an app, might be able to help at different points. So we got them to use these stickers to mark out, yes, there's be a possible, yes, an app might help here. We also asked them to think about how they currently communicate and how they'd like to communicate. And there was this real sense that actually right now they use group text to communicate, and some people actually just use pen and paper by the bed or the couch to record daily routines and important handover information. And they really felt that they could actually benefit from using an app. And so then we had people test an existing app, a prototype, and we got feedback what kind of things they wanted. And they wanted, a daily diary to capture the last 24 hours. They wanted space for emergency contacts. They wanted, to be linked to local support networks, and they wanted a place to fastly, really quickly record worries and concerns. What I like to do when I do any of these projects is actually work really hard on having active engagement. So as well as the co-design sessions, I asked participants to take photographs in a process called PhotoWise to record their experience of being a carer, and we had an exhibition and a launch of the app, and you can watch that in a video here. I can show you just a little bit. Oh, apologies. I will. Oops, I'll put the link in the Padlet so you can see that. One of the challenges we had though, and this is where intellectual property becomes a really important consideration. In the end, there was a bit of a fallout and some disputes about who owned what and how. And so currently the app's not on the market. But the positive part of this is we did bring people together, and there was a lot of talking and sharing and celebration and awareness. And they really enjoyed. We had a big exhibition to launch the outcome, which at the time was really positive. So thinking about engagement and outreach and representation and how you might be able to engage with and activate your community leaders and whether it might be a creative way to do that is also a really good consideration. And you can read a journal article here to find out a little bit more about that. What we're doing right now is we're working on Grief Guide, your 3 a.m. friend. This is a 12-week design sprint. We've just about finished it. We're in early development using AI, artificial intelligence, whereby this is an app that you can talk to it, and it's designed for people who are grieving or just experienced loss. And often they won't wake up at like 3 a.m. in the morning, have no one to talk to, can't ring anyone. And so we want people to talk to this app and have a conversation and get some support. So we're creating 4 avatars that people will be able to interact with and talk to: a talking dog, a rock and a stone, and 2 people. And it's quite exciting to see the potential of AI, and believe me, that it can respond extremely well. So that potential is there, and needs to be deployed more. This is an example of what our rationale is really. There's just not enough people to go around, so there needs to be some other support. So technology is always there, especially in the middle of the night. It's personalized and it continually improves. It can be personalized in tone and style. It can actually share resources, both legal and financial, and provide information when people need it. And so we're working on that right now. Another project I've been involved in is deploying virtual reality in aged care and developing a toolkit to support aged care staff in doing that. So we worked with older people on staff, and we, showed them how to use virtual reality, and we trained them up. What was really interesting, though, was, and part of the project was leaving the technology there, leaving them alone and going away for a couple of months and seeing if they did it. They continued the intervention when the research team weren't around anymore. Because that's one of the big challenges, to be honest, is technology adoption. Okay, how can we transform current practice and have it embedded, have technological innovation embedded, so it becomes more mainstream? And actually, of the 3 aged care facilities that we trialled here in Queensland, only 1 kept on doing it. The rest just didn't. They just went back to their normal business. It wasn't embedded. There was too much hard work. They just didn't keep on doing it, which was disappointing, actually. And in fact, got a phone call the other day from one of the aged care facilities with a new staff member, and she'd found one of the virtual reality headsets lying around with their phone number on it, and she wanted to know, what was this all about? And, so it's a really good example that sometimes if you're rolling out a program, the success for that program is only as good as the training and the people that are involved. And so how can you think about the sustainability of initiative, and what can you build in to keep that embedded when perhaps key champions or change agents are no longer there? The other thing we're doing right now is we're co-designing a chore robot, Helpy, and this robot is designed for aged care or healthcare, and it's to help with chores. So help clear tables, move things, fetch things, maybe transport things. So it's a bit of a transport kind of robot. And so we're talking about how that might be of value, and we've talked to leaders, and there's one aged care facility that actually has 10 different robots, from cleaning robots to transport and laundry robots, integrated into its practice. And so we're talking about how that works. And again, we're finding some challenges with implementation, and how you engage people and take them on that journey, and the process of having continued change agents and continued education is really, really important. So if we can have a conversation, if robotics is something that you're keen to explore as one of your transformation projects, we can talk about some of the tools and the processes and the learnings from this. I've got another project where we're looking at automated showering in aged care. So this is an automated showering system. Again, we're having some challenges with the rollout, actually. Whilst it's been successful overseas, it's been less successful in our Australian context, at least to date. What happened was that older people, they found the chair quite confining and quite just too small for them. They didn't feel very comfortable when they didn't feel that they'd been cleaned. And so they haven't really enjoyed the automated shower experience. So then there's a few sort of learnings there about proper engagement, education, and we're about to roll it out with people with dementia, because potentially they might like it better, because there wouldn't be a person involved, and some people with dementia especially struggle when it comes to receiving help and support from others. I'll just ask you, please don't share this example. This is one I'm working on at the moment. We're looking at a physical virtual care pod, but I'm sharing this because this might be of interest to some of you. We're looking at putting these. This is where Some people, like, there's a virtual care system, so you can access healthcare or hospitals. You can use your mobile phone and you can talk over the phone or have a Skype or a Zoom appointment and get some care. But some people, they don't have, might not have might not have a Wi-Fi at home or a phone, or there might be a reason that they can't talk about this health condition in their homes. It might not be a safe space. So potentially what we're looking at doing is creating these care pods or these virtual care pods, putting them in community settings. So maybe in shopping malls, maybe in, you know, could be in libraries, could be in universities, could just be, in old phone boxes. And there's spaces where people can pop in and have a virtual care appointment. And so we're in the process of exploring what that might look like and how that might work. And it is one solution to try and reduce the digital divide in the regions for communities and families that might benefit from these services. So the real key learnings when it comes to any kind of digital transformation initiative is you really got to think of end users. You've got to co-design it with them, listen, learn, and adapt. Really think about what is the real problem? Does the solution fit? Is this a challenge? Is it going to integrate into practice? Um, Tech alone is not the solution. You need to be really clear about that and alongside develop some resources, education, and have some change agent, have some champions working with you, engagement. Got to take people on a journey, got to teach and learn. Often your project won't be for everybody. Okay. I think of, like, say, Grief Guide. Not everyone wants to talk to an app in the middle of the night. Okay. But some people do, and you just need a market segment that's right for you. You have to be resilient. Some of these projects, and you know this as well as I do, it can be pretty hard going. There can be lots of knocks. Work in teams. You can't know everything, okay? And so it can be really helpful to work in teams with other people and ask all the obvious questions. You know, Sometimes we assume knowledge, and it's really important to ask questions and just to be that, have that beginner's mindset. Be open, share. I'm a great believer in what's called open innovation. So many of my things you'll find easily online. So, transport of change needs you to go on a learning journey. So you need to be open and share with others your learnings and your journeys and your mistakes and your missteps, so that we can learn, we can learn from each other. And that's really what this is all about. Transformative change, and particularly digital transformation. It's not easy, but we can get there if we do it together and if we learn from each other.